there is a hemorrhage in the skull, and that takes the shape of the skull that causes the cephal hematoma. This was the condition, and I have treated this particular child at my clinic, and she got cured. This is the rubric. I treated her with the Chyluria, and this case came to my clinic after 50 long years. Now you can see how this same child got cured. The same child came to my clinic after 15 years. So these are the type of cases, surgical diseases which you can cure at your clinic as well. Now coming to the next disease. This is a case called as Burger's disease. In the Burger's disease, this is a disease of the smokers, where in our books it is clearly written, either you can have your limb or cigarette. You cannot have both. It is called as thromboangiitic obliterans. You can see the condition of the patient where there is a digital ulceration, and this case got cured by the arsenic. Now this is the comparative dose. This case, surgical disease cured by the transfusion of arsenic of 0/1. Now coming to the next, this is the same case you can see, and coming to the next case, a very recent case. This is also a case of Burger's disease, when this patient was told by the surgeon that you cannot be cured without surgery. He need to cut the fingers. Now you can listen. This is the background of the case. Now you can listen.
कब से आपका घाव हुआ है?
ये हुआ है अभी 3 महीने हुआ, 3-4 महीने पहले।
किस डॉक्टर ने कहा कि उंगली काटनी पड़ेगी? हार्ट वाले ने कहा।
The surgeon told that this can only be cured by amputation.
ये तो खतरनाक रही है आपकी।
Now I have treated him, and with the sulfur. I can explain these cases for 1 hour, but I have time constraint. I am trying to sum up the different disease conditions where the surgery was the only option, and now sulfur transfusion was given, and you can see the difference. He was 60% better.
बोलिए केयर जी कैसे हैं?
He was 60% better, and now he got 100% cured. The fingers was saved. So this was the last condition of the patient. Now coming to the next condition. This is a called as medical emergency. The case of intussusception. It was also clinically diagnosed, and it was also diagnosed in the report. You can see.
उन्होंने बोला था ये चीज इंटरसेप्शन हो गया है। हाँ बोला था। उन्होंने बोला इंटरसेप्शन 4 से 10 तारीख तक नीला में हॉस्पिटलाइज्ड है।
Language is Hindi only because I am from the Hindi speaking region. That is from Lucknow. Now you can see ileocecal intussusception. This was the report, the first report. You can see in the CCTV how the person was, this patient was in the agony, and I have translated this medicine, sulfur. See the result.
कैसी हैं आप?
So I am only.
पहले तो ठीक है।
Now this is the final
कैसी हैं
part.
आप?
बहुत ठीक।
She got cured after interception. You can see the expression of the case as well.
बताया कहीं का?
खाएंगे मोटे तो होंगे, जब खाते नहीं तो दुबले वेट भी तो बढ़ेगा।
So this was the case, and in the comparative report from the same diagnostic center, interception was not there. From the Lucknow, this is the report. Now coming to the very severe disease condition. This condition is called as CSF Rhinorrhea or cerebrospinal fluid rhinorrhea. You will not find such cases in your clinical practice. I am fortunate enough that I am getting such cases which are refused, that they cannot be cured without the endoscopic surgical repair. And I have hundreds of cases of CSF Rhinorrhea from the different part of the country. These are the CSF leakage. In the next video, you can see how the CSF brain fluid is getting to the nose. Can you see? The brain fluid is getting leaked to the nose. This condition is called as CSF Rhinorrhea or cerebrospinal fluid rhinorrhea. There are different causes. I am going to explain all those things. So coming to the next video, these are the cases. You can see the dripping of brain fluid from the nose. This is a medical emergency, and most of the cases are treated with an endoscopic nasal repair. Sometimes sometimes the Dinox medicine is also prescribed. I have different type of cases from the brain tumor, from the spontaneous cause, from the head injury also. So these are the different cases, and all these cases are from my cases, and they got cured. So I am going to present only few cases of this. This is a condition called as CSF Rhinorrhea. The fluid which is running through the nose is accidentally leaking through the nose. There are the different causes: acquired and congenital cause, traumatic and non-traumatic cause. Any factor which increases the CSF pressure can cause the CSF leak. And I have seen in my clinical practice, mental stress is the one of the most important cause. Even COVID was a cause, because in the COVID condition there was frequent sneezing and coughing, and that has caused CSF leak to the many patients. So this was the cause. Diagnosis is made. Why I am telling all these things? Because you are not going to find such cases. Even you can miss such cases in your clinic, assuming that it is general coryza. The nose is dripping with the coryza. No, it's not coryza. The chemical diagnosis is the beta transferrin, a very specific protein found in this particular fluid. Another is the CT cystoscopy. Normal CT scan and MRI miss this diagnosis. There is a specific test called as CT cystoscopy. Unilateral discharge without coryza, and one home diagnosis is also there. If the patient is getting leak and they are taking that fluid in the handkerchief and handkerchief is not getting stiff, that means it is CSF Rhinorrhea. Because in the nasal fluid, there is a mucin content that making the handkerchief stiff. But in the cases of CSF Rhinorrhea, handkerchief will never get stiff. So these are the cause management in the surgical endoscopic nasal repair, and obviously I am treating all these patients with homeopathy. This is a rubric, because you can see head cannot expand after the fusion of the sutures. So this is the most important rubric. In case of spontaneous leak I am taking. In the injury case you can take the rubric head injury. So this is the first case. You can see follow through the case of CSF Rhinorrhea, bony defect in the cuneiform plate, and this case got treated and there is no bony defect. That is CSF Rhinorrhea, my first case. And now coming to the next case, this is a live case from the Bangalore itself. She got treated. The first consultation, online patient, she sent her hair from the Bangalore.
CSF Rhinorrhea हो गए
और 2 साल से CSF Rhinorrhea है।
ये कम हो गया
Now see, these are the reports, the specific protein 119. Coming to the remedy, this was the nitramule. I have started transmitted.
बोलिए दूसरा जी।
जी हाँ, आज सुबह से बहुत खांसी शुरू हो गई है।
Now
Hello.
next follow, and this is the final follow, and the patient got
हाँ,
cured.
मेरा तो CSF बहुत अच्छा है।
Coming to the other case, this is a patient from Lucknow itself, and she came to my clinic, and you can, what happened? Yes, you can see the CSF was getting leaked through the nose. You can see at that particular place. Laser is not working. You can see this CSF is leaking, and now I have transferred Chyluria from my center. This is the first
मोनिका जी
follow.
कैसी हैं आप? कैसी हैं?
मैं ठीक हूँ।
60% reduction in the CSF.
CSF की कितना फर्क पड़ा आपको?
7% फर्क पड़ा है।
60% got reduced. In the next follow, you can see 100% cured.
और बड़ा सा लंबा तिलक पड़ गया।
Language is only Hindi, because I am
उसके
from.
बाद
कैसी हैं मोनिका आप?
This is the final report, and she got cured. Now coming to the other case of CSF Rhinorrhea, you can see there is a one bony defect of size 6.5 mm.
जब झुकेंगे तो आएगा पानी?
6.5 mm. Bony defect in the brain.
अरे बहुत ज्यादा आ रहा है। अब इस कंडीशन में आपको बिना सर्जरी के कोई भी डॉक्टर नहीं बोलेगा।
Now coming to the rubrics, these are the rubrics. Hydrocephalus, leukocyte element from Boster. These are the rubrics I have taken, and Naxonka was transferred. And no CSF leak after.
कैसा CSF leak आपका?
This is a very recent case. And
कुमार कैसे हैं आप? कैसे हैं आप?
This is complete recovery, and I have paused his treatment. And in the recent report, the 6.5 mm defect in the brain got cured. With the recent report, bony cribriform plates appear normal. So it's not only cured clinically but also pathologically. Another case of left ventricle failure. You can see 35% ejection fraction was there, and this was the condition.
नहीं कुछ ज्यादा खत्म नहीं हुआ, थोड़ा सा आपका हार्ट में थोड़ा सा प्रॉब्लम है, हाँ।
And I have treated this particular patient left ventricular failure ejection fraction also only 35% with the lachesis transition. In the final report, you can see ejection fraction was 65%. The LED is not much clear, so
दो दिन में हमें यह कैसे
नहीं, जिन डॉक्टर को आपने पहली रिपोर्ट और बाद की रिपोर्ट दिखाया,
this
उसने क्या कहा?
treating doctor was amazed that how nobody can cure such disorders with the. Now coming to the next disease, this is a disease which you might have never seen in your clinical practice, and I am fortunate that I have lots of cases. I have treated more than 15 or 20 cases of this disease condition. This disease condition is called as Hirschsprung's disease. It is one of the cause where congenital, it is also called as congenital megacolon. When the rectum, the last part of the rectum, there is no ganglia, so there is no penetrative motion, and the child passes the stool late, sometimes initially and sometimes in the later session. So this is the congenital megacolon, the disease condition. Surgery is performed. These are my real patients. You can see the abdominal girth of my patients. These are the called, even the surgery is performed in this particular two patients, and later the problem was not resolved and I have treated and they got cured. Not only with them, this is the case which I have presented in earlier seminar, so I am only presenting the report. In the first report from the same center, Hirschsprung disease, and in the next report there is no suggestion of Hirschsprung disease, and the case got treated with the transmission of anacardium 0.1. Coming to the next case, this was the Hirschsprung disease आपका diagnosis.
ये तो फिर डायग्नोसिस है जनवरी में आपकी बात,
जनवरी में
ट्रीटमेंट तो इसका चल रहा है 6
ये कैसे बंद होता है?
ट्रीटमेंट
तो तब तक